ARPA-H can really step in cases where the science is really ripe, but the financial incentives may not be lacking, and the financial resources may not be quite there. There's quite a lot that we're still trying to rebound from when it comes to COVID. I don't think any of the centers have seen a true recovery, despite best efforts in education, in trying to make public proclamations about the importance of screening. We've not recovered. So things that we can do through policy, through research to understand barriers to screening, which is in part funded by the NCI, and in part funded by ACS, are really important. But it's also the case that there are things that I think we can advocate for just within the cancer care or within the healthcare community itself.
I think we will come back to look at the present time of cancer research as really a golden age of cancer research. We have all this progress and prevention and screening and new therapeutics and really a new armamentarium and new ways of treating cancer and a new molecular understanding of cancer. The advances that we make within the Moonshot will be, disseminated to all populations, regardless of wealth and access. At one end, we have a sort of basic science to translational initiative like the Human Tumor Atlas Network, which is a big data initiative to generate very intricate atlases of cancers as they develop. So starting at very early stage to metastatic disease and different tumor types and different populations of patients, and really then generating just massive amounts of genomic and RNA and protein and clinical data, and putting all of that data in the public domain as accessible through our web portal. We found that there are many patients who are actively smoking, who are going into cancer centers, often for treatment of smoking-related malignancies, and they hadn't really been offered smoking cessation counseling. And smoking cessation is now quite successful, and there are multiple FDA-approved products or FDA-cleared products for this. And so we were concerned that this wasn't being offered to all patients. Through a Moonshot-backed supplement program, we now fund cessation services at more than 50 NCI-designated cancer centers.
Our eyes have been opened up to the issue of health disparities in cancer, both from the diagnostic side all the way to the treatment side. And with all the advancements we made in diagnosis and treatment, and really it is being a golden age, and look at new therapeutics, IO agents, and cellular therapies. We also have a big problem of how do we pay for this?